Hi guys, welcome back to Brain Gist. Today I want to talk to you about Bell's palsy. Sometimes it can be a very frightening experience for people when they just suddenly wake up in the morning and notice that one side of their face is paralyzed and they can't close one eye as they would normally do. So they can sometimes get so frightened and rush to the hospital thinking they've had a stroke, and that's what I'll be talking about today. But first of all, I'd like to welcome you to Brain Gist. In case this is your first time, this is a channel dedicated to educating people about the brain and the entire nervous system, all the things that you need to know. So do stick around, subscribe, comment, share, like. I'd like to see your comments and your reactions. All right, so what is Bell's palsy? Bell's palsy is simply an inflammation of the nerve of the face called the facial nerve. So, like we all know, there are nerves in every part of the body. So, the brain is the executive commander who sends or which sends signals to all the muscles in the body, and the face is part of them. So the face has got so many muscles, like the muscles to help you to wrinkle your forehead, to make all sorts of expressions, to be able to blow a kiss, wherever you want to do, all the movements on the face are controlled mostly by muscles which receive signals from the nerve of the face. So we've got two nerves that control the face basically, one on either side, and that's called a facial nerve. So the name is very easy to associate with the part the body controls, the facial nerve. So for the face, you've got the two of them coming out from about here and then fanning out and helping to move the muscles of the face here and there. So if anything at all that you would imagine, if anything at all happens to this nerve, then all the muscles of the face on that side would suffer. So this is simply what happens in Bell's palsy. So we think it's an inflammation of the nerve that causes that situation. So what is inflammation? That's the sort of thing you feel when you have a flu. So when you have a flu, you have swelling with the inside of the nose and the upper airway. Everywhere is swollen and can be painful. You can start to secrete some liquids and you can't use that part of the body really well. So that's the kind of thing that happens. So we think it's a kind of viral infection of the nerve, of the facial nerve, that causes it to become inflamed, and therefore it loses function, and that part of the face, you're unable to move it as you used to. So what are the symptoms that you see? So usually you would have weakness on that side of the face. The individual may be unable to, you might see loss of the forehead creases on that side. One side is creasing up, yet the other side is flat. Such individual might be unable to close the eyes. That's a very common sign that we see. You might see the eyeball rolling upwards, one eye is closed and the other one is unable to close, and that has implications for treatment. You might see that one side of the face is twisted to one side, or the mouth rather. You might see something like this, because this side is active and this other side is inactive because of the injury to the facial nerve or the inflammation of the facial nerve. Therefore, the angle of the mouth is shifted to the active side. There's no balance between the two sides. So these are some of the symptoms you might see. So this can be very frightening. Some people will think they've got a stroke. So usually you need an experienced physician or a neurologist to examine and confirm that it's indeed Bell's palsy, which is an inflammation that's less worrying than a stroke. So what do we do to confirm Bell's palsy? So usually sometimes we need to do some electrical tests like nerve conduction test and blink reflex that helps us to give confirmation or evidence to it, and we can assess the level of injury. Not like you would expect after a flu, that eventually after some time people recover. So the nerve also tends to heal and recover, and then the movements that have been lost recover. Occasionally, if the level of injury to the nerve during the inflammation is severe and extensive, then recovery may be partial or not full, but most people recover within a month to 3 months, and if people who have Bell's palsy present early, we tend to give them steroids to kind of limit the damage to the nerve from the inflammation, and hasten healing and accelerate the recovery process. And very importantly is the fact that a lot of people who suffer from Bell's palsy are unable to close the eye fully on that side, and that exposes a very sensitive part of the eye, and when such people are sleeping, so that can cause damage, and in some people it could actually lead to blindness. So that's extremely important. So when we treat these people, we tend to give a kind of ointment that they put on in their eyes when they go to bed, and sometimes we encourage them to tape the eye so that the eye doesn't dry. That sensitive layer of the eye, that's the black of the eye, the cornea, doesn't dry and then cause irreversible visual loss. And then we also do physiotherapy and other interventions. So basically, this is what Bell's palsy is about. So I do hope you learned something today. I like to hear your comments. I like to, you to share the video. I like you to subscribe, of course, and turn on your notifications. So I hope to see you again on my next video. Thanks for watching today. Bye.